Aloha! I'm going to talk with you today about leucovorin and autism. Since 2011, I've been able to use my specialized medical training and clinical experience to help hundreds of children with autism get better. I've been prescribing leucovorin for 15 years to counteract a serious impairment shared by 75% of children with autism. This is something called cerebral folate deficiency. I'll get to that in a moment. Let's get some clear definitions to start. The names are similar, but the consequences couldn't be more different. Folate is the natural form of vitamin B9 and is found only in food, things like leafy green vegetables. Folate is a B vitamin that's critically important for normal brain function and development. There's different types of folate. So folic acid is a synthetic man-made version of folate. It's created in a lab. Folinic acid is a specific form that is able to get into the brain cell. Leucovorin is a specialized version of folinic acid. Now, let's come back to what I talked about earlier, cerebral folate deficiency. This is a severe deficiency of folate in the brain cells. And we see this condition in about 75% of children with autism. This is caused by something called folate receptor antibodies. These are proteins made by the immune system, and most children's brains aren't hindered by these kinds of antibodies. But for children with autism, what happens is that these antibodies are blocking folate from getting. Because most children with autism have this, most forms of folate can't get past the antibodies and into their brain. So worse yet, the synthetic form, folic acid, actually makes the condition worse. In short, children with autism have antibodies that prevent most forms of folate from being absorbed by the brain. Folinic acid prescribed under the name leucovorin is an exception. It is able to bypass those blockages. So why does this matter? In early pregnancy, folate is essential for the formation of the brain and spine. Without it, there can be speech and language delays, movement disorders, sleep disturbances, irritability, and seizures. And actually, throughout life, folate remains important for our nervous system to function properly. By adding leucovorin as a part of our complete autism treatment protocol, I've seen some remarkable improvement in many, many children. However, I will also stress that I think it is vitally important to work with a practitioner who understands autism. With autism, every child system is unique, and it requires advanced laboratory testing in order to arrive at the appropriate treatment protocols. With leucovorin, those tests help us to determine the appropriate dosage over a certain time period. We then follow up and regularly adjust the dosage. Now, parents may get lucky in using it without oversight, but they might also get unlucky. And there are many examples of leucovorin that can make a child's condition worse temporarily. So they could become hyperactive or have more tantrums, worsening sleep patterns, and more repetitive and self-injurious behavior. In fact, here's a word of caution about leucovorin tablets. The lowest dosage for one tablet is 5 milligrams, but one tablet is actually a high dose. So I typically never start children on the leucovorin tablets. There is a liquid over-the-counter form that I always start with, and that's because one drop is about 1/7 of the lowest dose of the leucovorin tablets. And it's also the typical amount of folate you get in a substantial multivitamin. So by starting on a low dose, the children are able to tolerate it, and the outcome is typically much better. So this is why when it comes to leucovorin, it's much, much safer and more effective to work with a doctor or practitioner who understands autism. That being said, for many of the children I've treated, leucovorin can be like a miracle cure. So there was a 2-year-old boy who I started working with. He only had about 15 words when I first started working with him, and it was just single words, not sentences. And he also had very frequent meltdowns and tantrums. I started him on leucovorin as part of my treatment protocol, And I also worked with the family to start the boy on a gluten-free and dairy-free diet, along with other measures to clear up his gut issues. 3 months later, he started talking a lot more, and his language had continued to improve. And it was really right after he'd started the Leucovorin that we saw some significant improvement in his language. And a year and a half later, you couldn't even tell that he had autism. He literally lost his autism diagnosis because he didn't look like a child with autism anymore. Another patient that I have was an older child who came to me, was 9 years old when she first started. She had autism as well as ADHD, and it was hard enough for her to pay attention and focus, but she also had hyperactivity and impulsivity. She could speak, but she was only able to use very simple words and form short sentences, and she also had difficulty understanding what was told to her. So I have been working with her and her family for almost 4 years now, with Leucovorin as a part of our treatment protocol. And we've gradually increased the dosage along the way, and I can definitely state that the Leucovorin has helped her to make very clear, significant improvement with her language, her attention and focus. Her language is now very close to being typical for her age, for a neurotypical girl her age. She also has a social life. She engages in conversation. She has friends, and her attention and focus is much better. She can focus. She's no longer hyperactive or impulsive. So in general, for children with autism, the best source for making sure that their brain is getting enough folate are whole foods. So things like dark leafy greens, lentils, peas, beans, broccoli, nuts, and bananas. I know that many children with autism are very picky eaters and may not eat these foods. So it's important to really look at what's going to be right for the child. And in many cases, supplementing is really needed if the child does have cerebrofolate deficiency. What you want to avoid are foods that are fortified with synthetic folic acid. So these are things like bread, pasta. They are typically fortified with folic acid on the label. And in fact, packaged foods of any kind, you want to make sure to read the label carefully. So just about all the big food corporations use folic acid, which, as you now know, is not the form that will help a child with autism, and it's important to avoid it. So Autism has been valuable for you with our no-charge phone consultation. You're welcome to talk with me personally about any health concerns that you may have so that you too can be empowered with your health. All the contact information is on our Facebook page. For vitamins, minerals, and other natural remedies, please visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are very competitive with Amazon. You can trust the products, and the proceeds go to helping children with special needs with their medical treatment. So a link is in the post with this video. Mahalo, and I look forward to seeing you in another 2 weeks. Aloha.